Hello and welcome. Today we're diving deep into a specific type of aortic disease, the penetrating aortic ulcer, or PAU. It's a serious condition that demands our attention, and understanding it is crucial for early detection and effective management. We'll explore everything from its causes to its potential treatments, so let's get started. So, what causes a penetrating aortic ulcer? Unlike a classic aortic aneurysm, which involves a general bulging of the aorta, a PAU is more of a localized event. Think of it as an erosion or ulceration into the wall of the aorta. The main culprit behind PAUs is often atherosclerosis, the build-up of plaque inside the arteries. This plaque weakens the aortic wall, making it vulnerable to ulceration. High blood pressure is another significant risk factor, as the increased pressure can further damage the weakened aortic wall. Other factors like advanced age, smoking, and pre-existing aortic disease can also contribute. Now, let's talk about the pathophysiology, what actually happens in the body when a PU develops. It starts with the plaque build-up we mentioned, weakening the inner layer of the aorta, the intima. This allows the ulcer to penetrate deeper, past the intima and into the media, the middle layer of the aortic wall. This penetration can lead to several complications. It can cause a hematoma, a collection of blood within the aortic wall. It can lead to an aortic dissection, where blood tears through the layers of the aorta, creating a false channel. Or, in severe cases, it can lead to aortic rupture, a life-threatening event. Understanding who is most affected by PAUs is essential. The epidemiology of penetrating aortic ulcers reveals that they are most common in older individuals, typically over the age of 60. Men are also more frequently affected than women. Individuals with pre-existing conditions like high blood pressure, atherosclerosis, and other aortic diseases are at a significantly higher risk. It's important to remember that these are just trends, and PUs can occur in individuals outside of these demographic groups. Recognizing the signs and symptoms of a PIU can be challenging, as they can be similar to other aortic conditions or even mimic other health problems. The most common symptom is severe, sudden chest or back pain. This pain is often described as tearing or ripping. Other symptoms can include abdominal pain, nausea, vomiting, and shortness of breath. In more severe cases, depending on the location and extent of the ulcer, neurological symptoms like weakness or paralysis can occur. Because these symptoms can overlap with other serious conditions, it's vital to seek immediate medical attention if you experience them. Diagnosing a penetrating aortic ulcer typically involves a combination of imaging techniques. A CT scan is often the first-line diagnostic tool, providing detailed images of the aorta and allowing doctors to visualize the ulcer, hematoma, or dissection. An MRI can also be used to provide more detailed information. A transesophageal echocardiogram, or TE, which involves placing a probe down the esophagus to visualize the heart and aorta, can be useful in certain cases. The choice of imaging modality will depend on the patient's condition and the clinical suspicion. While there isn't a formal classification system for PIs in the same way as for aortic aneurysms, they are often categorized based on their location in the aorta. They can occur in the ascending aorta, the aortic arch, the descending aorta, or the abdominal aorta. The location of the ulcer can influence the treatment strategy and the potential complications. Treatment for a penetrating aortic ulcer depends on several factors, including the location and severity of the ulcer, the presence of complications, and the overall health of the patient. Medical management, which includes controlling blood pressure with medications and monitoring the ulcer's progression, may be sufficient for stable, uncomplicated cases. However, surgical intervention is often necessary, especially if there is a risk of rupture or dissection. Surgical options include open surgical repair, where the affected section of the aorta is replaced with a graft, or endovascular repair, where a stent graft is inserted through a catheter to seal off the ulcer. The choice between these options depends on the specific circumstances. While preventing a penetrating aortic ulcer entirely may not always be possible, there are several lifestyle modifications and medical strategies that can significantly reduce your risk. Maintaining a healthy lifestyle by not smoking, eating a balanced diet, and exercising regularly is crucial. Controlling high blood pressure and high cholesterol levels through medication and lifestyle changes is also essential. If you have a family history of aortic disease or other risk factors, talk to your doctor about screening and preventative measures. The prognosis for a penetrating aortic ulcer can vary greatly depending on the promptness of diagnosis, the effectiveness of treatment, and the presence of complications. Untreated PUs can have a high mortality rate, especially if they lead to rupture or dissection. With timely diagnosis and appropriate treatment, the prognosis can be significantly improved. Research is ongoing to develop better imaging techniques, less invasive treatment options, and more effective strategies for preventing PIUs. Newer stent graft designs and advancements in surgical techniques are constantly improving outcomes for patients with this challenging condition. Stay informed and prioritize your cardiovascular health.